Youth adjudicated of criminal offenses that land them in detention facilities to serve out their sentences have a disproportionately high number of adverse childhood experiences. The days of juvenile justice being solely about keeping a child in custody are over. Juvenile justice in this country focuses on support, services, and treatment. Youth detention facilities that have started using a trauma-informed training have seen a decline in the use of restraints and seclusion to address aggressive behavior and a decline in threats against staff, along with reductions in symptoms of post-traumatic stress syndrome like nightmares, avoidance symptoms, hopelessness, depression, and anxiety. The youth in the detention facilities report that they felt safer and more able to control their negative behaviors when the staff understood that they try to control their behavior, but the hurt, pain, and fears from their childhood experiences interfere with that. When attempting to create a trauma-informed correctional care with a balance of both goals and environment, it is beneficial to take a who, what, when, where, why, and how approach. By using this method, it is easier to be sure that everything that is important in making these changes happen has been addressed.
Change starts with people like you and me. Change in correctional care facilities needs to happen. And the people who need to initiate this change in these facilities are the staff. The staff needs to be informed about the trauma of the kids who are entering these correctional care facilities. By knowing what the kids have been through, the staff will be able to understand how to help these kids better themselves.
Trauma can be defined as an emotional response to a terrible event. A recent study found that at least 90% of juveniles have experienced a traumatic event in their lifetime. These traumatic experiences and the brain's natural responses to trauma can cause juveniles to display and act upon that trauma in a negative way. And sometimes it leads to being put into juvenile detention facilities. However, with new studies on how effective juvenile detention facilities are at making these traumatized juveniles feel and act better, there's now a common finding that detention centers using trauma-informed training have seen more positive results with these juveniles. They feel more at ease and they feel they're better able to understand what has caused them this trauma, and they've also learned better ways to cope with their trauma. But the staff that helps these juveniles with their trauma have to be trained in certain ways so that they're able to better understand the juvenile's trauma so they can help the juveniles get better. But they're not just trained to help the juveniles get better. They're trained to understand that the juveniles, they're doing their best to control their natural response to the trauma they've experienced, to control their behavior, but that the PTSD that they have from that trauma, it will always be a part of them, and it will sometimes disrupt the healing process and all the progress that the two people have made. The main focus of trauma-informed training is the question of what happened to you rather than what's wrong with you. This is what the staff of juvenile detention facilities using trauma-informed training are focusing on. They're trained to get the whole picture of a juvenile's life, both past and present, so that they're able to provide effective healthcare services that involve healing, as well as coping. The staff of the detention facilities are thought of more as healers and not as treaters. And since it's such a much more positive term, it helps the juveniles feel less demonized and that they actually have a rationale to their behavior. It helps them feel as though what happened to them and the resulting behavior caused by what happened to them won't be such a great struggle throughout the course of their time in the facility. A few things that the detention facility staff are also trained in to help the juveniles are what they call the 4 R's. 1, realizations about trauma and understand how trauma can affect families, groups, organizations, and communities, as well as individuals. 2, to recognize the signs of trauma. 3, responding to trauma by applying principles of the trauma-informed approach. And 4, resisting re-traumatizing of the clients. The staff are also trained to anticipate emotional responses of the juveniles because of that trauma. And all of this knowledge of all the different methods of how to approach trauma-informed training helps both the staff and juveniles in the facility.
Now the question is, when will the training be conducted, and then also when will it be used in the incarceration process? The idea for this change is for state, local, and private facilities to stray away from their get tough policies that are often morphed delinquent youth into hardened criminals, which only farther traumatize already traumatized kids, and then lean towards becoming agents of change, which means starting to develop adverse childhood experiences and trauma-informed training for staff and systems for their facilities. Each state should mandate trauma-informed care training. The state of Texas already has had this mandate in its legislators since 2013. Texas' plan consists of mandatory 6-hour training for people currently in the facilities, along with ongoing training throughout their time working in order to continue revamping their facilities. Texas' plan is a good step for furthering the betterment of the juvenile justice system. Each state should progressively add training in 6-hour increments, just like Texas did, but instead of just one training session, it should be multiple since there's a lot to be known and learned. The training should be mandatory for everyone already in the justice system, but also for the ones coming into the system. For the training to be used in the incarceration process, guards and workers should take the time to think about why the kids are acting how they're acting, rather than the get tough mentality that was previously mentioned. Each childhood's experience is different, and some kids will react differently, which is why extensive training should be needed.
Children in these detention facilities are coming from completely different backgrounds. Some of these children have never experienced a normal family or home environment. Most children in these situations have severely rocky relationships with their parents and even just adults in general. Because these children are not able to trust even their own parents, often they have an extremely difficult time trusting any adults in authority. This becomes an issue when the staff at these juvenile facilities are trying to help the child through the troubling times that they are experiencing. It is crucial that these children are able to build their relationships and feel like someone is there for them. Oftentimes, all a child needs is for someone to listen to them. This is why these new training techniques are necessary to helping kids build a better life for themselves. These children have all been through way more than anyone at their age should be, so with that being said, they need someone in their life that they can turn to and who can give them guidance to turn their lives around. Children can experience trauma in all different forms. Some of the most common forms of trauma seen in juveniles are emotional, physical, or even sexual abuse, neglect, divorce and domestic violence, the mental illness of a parent struggling with addiction or substance abuse, and much, much more. This training will cover each of these categories and many others. This training will allow the employees a completely different perspective, and they can dive deeper into the nitty-gritty of each child's trauma. If the facility employees are trained to specific categories, they will have a better knowledge and understanding of how to deal with each child, and they'll be able to individually cater to their specific needs because of their specific situations. According to a study conducted by Florida State University, recently the specific definition of ACEs, adverse childhood experiences, has been expanded to include bullying, behaviors or violence in the community, economic and financial barriers and issues, and also discrimination. If a child is growing up in a bad area full of crime and violence, they are going to learn that behavior, as we know from the social learning theory. Children need someone in their life that is putting a good influence on them. These people can be the trained facility employees. If one of the employees can learn how to build a connection with the juveniles, then they can help them set personal goals and inspire them to be something great.
The training already implemented in these facilities is beneficial, but can always be improved. Some facilities use online programs that range from a 20 to 35-hour course, but these programs don't give adequate training for an in-person job. Taking out online courses and implementing in-person classroom settings will greatly improve their ability to recall and recognize previously learned information. In-person training will also encourage teamwork and interpersonal skills that are needed for this job. Having classroom training for a mandatory 2 weeks out of the year is reasonable. Training will be implemented with a hands-on approach that will be focused on social skills and not so much the criminal justice field. External coordination of child psychologists, social workers, and other guest speakers should be included in training to broaden the scope of the workers' understanding of the job, goals, and influence they have while at work.